Floating navel piercings, pros, cons, advantages, disadvantages. Also going to talk about what you should know beforehand, getting the piercing done, healing the piercing, jewelry options, also living with the piercing, and what happens if you go, I don't want this, and abandon the piercing. Coming up next on Pros and Cons by Piercer, Season 2, Episode number 97. For those that are new to the channel, welcome to the Body Piercing and Tattooing channel. If you're enjoying the videos, if you're finding them helpful and useful, but you may not know who this handsome feller is. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and operate the Axiom Body Piercing Studio, located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. So I'm going to be talking about a floating navel. For those who don't know what a floating navel is, it is a navel piercing that is done more inside the navel on the bottom, where it produces a situation where it looks like there's only that one top piece, gem setting or whatever, that is, it looks like a single point piercing. I don't know how else to describe it, like a dermal on your stomach. The reason why these are needed to be done is a lot of people don't have the anatomy to do that more traditional, you know, the barbell with the two gems on both sides, either because of their body shape or their body style or the shape of the navel, their anatomy basically, or it's a situation where when they sit down, that navel collapses. So putting a large gem setting in there is going to cause it to constantly be moving up and down and could agitate or cause problems. We use jewelry that has, I usually suggest threaded jewelry, for the reason that you can kind of adjust that top one, especially if you have something that's shaped so that it looks like it's straight, instead of being cockeyed, you know. Nothing's more annoying than that. And on the bottom is a flat disc. We're piercing this in much the same way that we used to pierce navels when I first started, when we were doing it with rings. They were more done inside the navel, with the top being a little further down than what we do when we're doing more of that, you know, the two gem, traditional, I guess, normal navel piercing. I'd like to say this is a modern invention, but really it isn't, because we used to pierce things this way, and then kind of the availability of curved barbells, they got a lot more available, so it kind of all switched over to that. And then people started going, oh, you know, all these navels I'm turning away because we'd have to pierce deeper in the navel. Why don't we use some type of different jewelry? Thus, that's how the floating navel was developed. So let's move on to the pros, the advantages, the things that make you go, yes, I need that in my life. Starting with number one, this piercing can be done on anatomies that normally we would have to pass on because there would be a lot of issues with the piercing rejecting or causing excessive scarring or migrating or just simply not healing correctly. Most common thing I see with misdone navels is they're done to try to be more like that traditional thing, but because of the shape of the person's body, they're pierced way higher than the navel. They're not even in the navel at all. They're above it, and that's the surface piercing, and those usually don't last. This gives us the option of piercing those people that we would normally go, I'm not going to advise you get that done. It's just going to be nothing but problems, to have a navel piercing. Number two, this piercing will work with those that have a navel that collapses when they sit down. It's going to be a lot more comfortable. It's not going to be poking you all the time. It gives you, once again, on an option to do this piercing on a lot of people that we would not suggest getting more of the normal navel piercing. Number three, the reason why we do these, it enhances the look of the body, draws attention to it, beautifies it. With this one, there's a lot of different jewelry options, so you can do a lot of fun things with this one. Which brings us on to number four, a large variety of different jewelry. Because of the threadless and threaded jewelry options that are out there, you can get a lot of different types of tops to these. Everything from very simple gemstones up to very elaborate 14 karat multi-gem settings, things that are shaped or more like a UFO kind of shape, things dangling off of it, all kinds of fun stuff, chains and so forth. And number 5, this can give that appearance of looking like a dermal, microdermal, or a single point piercing, but not all the rejection issues and et cetera that go along with that. This is a piercing that is built to last. You could have this for the rest of your life. It's not a temporary situation like you would generally have of a single point piercing, where you might have a lifespan of anywhere from 7 to 10 years. Now let's move on to the cons, the disadvantages of things that make you go, no, I don't need that in my life. Start with number 1, limited with the type of jewelry you can wear in this. This is kind of a double-edged sword kind of thing. Yes, there's a lot of variety out there, but you do definitely need that flat disc on the inside. You can't really put, you could try, but depending on the size of your navel, how much room is in there, you can't put those gem settings in there. Double ball, the double gem setted curved barbells. It's not gonna. You're probably not gonna be able to see that bottom ball at all, and if you can, it's gonna be constantly just kind of agitating the area. So it's usually you're kind of just stuck with those that have that flat disc on the bottom. So that kind of limits your options as far as jewelry. However, it would be possible once this piercing is well seasoned and healed that you could wear a ring in it, or circular jewelry of some type, more so than the more normal navel piercings. Number 2, long healing period. These can take anywhere from 6 months to a year. They are a commitment. They are in an area of the body that can be a little difficult to heal, mainly because of blood supply and because of the flexibility of the area and the amount of contact the area gets. Number 3, cannot wear pants that are against the area. So those high-waisted women's cut pants that come halfway up to your armpits, cannot wear them, especially the ones that have the Guess jean style, super wide waistbands that are really cinched. That constant rubbing and agitation will cause issues. In some cases, even after the piercing has healed. Number 4, cannot sleep on your stomach. Sleeping on your stomach will cause issues with this particular piercing. We move around a lot in our sleep, and that pressure against there will cause problems. And the last one, number 5, can close fairly rapidly. This is not a piercing that you can do it, heal it out, take the jewelry out for days on end, and put something back in, even after decades of having it. They can close pretty rapidly. So let's move on to preparing for the piercing. First and foremost, find a piercer that has a lot of experience with this piercing. It's a fairly new thing, and it requires stocking a lot of different types of jewelry that maybe most places are not going to have. Mainly the post section. So that's an added cost not everybody's willing to take. You really need to find somebody that has some experience with this, because they have to place it correctly, or otherwise you're going to have issues, especially if they try to do this with just a normal, on the edge of the navel, just slightly inside, with the way that we do it with the standard curved barbells. They should give you a consultation beforehand. They should talk to you, especially if they're advising you to get this. They should be able to explain that to you. They should evaluate your anatomy to see which of the two is going to work best. It's really common for somebody to set up an appointment for a floating navel, mainly because in the alphabetical order, it comes before the normal, the other navel. So they'll come in thinking they're just getting that, and we have to sit down and kind of just describe the difference between the two and evaluate them and see what's going to work best for them. This comes from experience of looking at that navel and knowing what's going to work or not work. Also taking the time to do it. Now, with the consultation, that should cover any risks that are involved, checking your anatomy, of course, what type of commitment it is as far as cross-contamination prevention and cleaning properly and et cetera. They should go through all of this beforehand. Also, if you have any medical issues or whatever, or questions, they should be able to address that at that point in time. And every piercer should do this verbally before you get the piercing or commit to it. The jewelry should be of a high standard biocompatible material. Most common with this, and to be honest with you, I'd be surprised if you find anything else, is implant grade biocompatible titanium. It should be third-party tested and safe. This piercing does demand isolation. Make plans in advance. If every pair of jeans you have is women's cut with a high waist, go hit a thrift store or go on a spending spree before you get the piercing so that you have that wardrobe available. You can't cover it up with Band-Aids and do all this other stuff that's going to solve the problem, because it's the movement that's caused when you get up and sit down that causes this problem. That and just having metal objects and et cetera against the jewelry is just not a good idea. So plan ahead, have the proper clothing available before you get it done. This piercing may take up to a year to heal. You need to understand that commitment. This is not something you can take care of for about 3 weeks and then be like, it's healed. I don't have to deal with this anymore. You're going to be dealing with this for a while. And I'll get into all the things you're going to need to do that we cover in the consultation when we get to the healing part. So stick around if you're a little unsure about the commitment. This jewelry may need to be downsized. Sometimes they're oversized a little bit for one reason or another, or we get a little bit of migration where a tighter piece of jewelry is going to fit better in your navel than a really long one. That usually can be done anywhere from, with a navel, I would suggest waiting at least 6 weeks to 8 weeks before you do that. The jewelry should be somewhat tight-fitting. We want to avoid a situation where it's so tight that when you move or sit in certain positions, that the area kind of expands and it pops off if it's threadless, or it's really uncomfortable if it's threaded. And with this one, as I mentioned earlier, threadless jewelry is usually the best option. It's going to give you the biggest amount of variety and be less cumbersome and less to deal with. However, threadless jewelry is perfectly fine if that's the option you're given. The only disadvantage of that is you do have to check that threading on a regular basis and make sure it doesn't come unscrewed. Now let's talk about the piercing experience itself. I would say on a scale of 1 to 10, this is between a 2 and a 3. It is not a very painful piercing to get done. There's not a lot of nerve endings in that part of your body, and most people are not really sensitive in that area. As far as the experience itself, it does feel a little strange to have people rotting around and moving around and touching and feeling in an area of your body that you normally don't. Most people don't touch your navel. It's kind of weird. We don't really think about that. It's kind of like, people sticking fingers up your nose, which piercers also do. So that might feel a little strange and a little uncomfortable. First thing we're going to do is we're going to go through the consultation I already talked about, cover all that subjects. Then we're going to go pick out some jewelry, which is kind of a fun part because you can be kind of creative with this. Once the jewelry's selected and everything's great, we'll go back in the piercing area, or beforehand, I'll have you fill out a waiver. Now, waivers will cover, first off, it releases us to do the piercing. It verifies that you're of a age or have a guardian that's willing to consent to the piercing. Most places you have to be at least 18 or have a parent present. After you've done that, also in there is going to be like medical conditions, medication, all kinds of stuff about intoxication and et cetera. It's important you read those. Just don't click them off, because there might be something in there that you're unaware of and that you need to address with your piercer before they're willing to do it. I'd much rather know that you're on blood thinners beforehand than find out when we're sitting there for 2 hours trying to get something to stop and I'm searching, I end up having to take you to urgent care, which I've done in the past because somebody lied to me. Anyway, once we've got all that done, we will just set up all the equipment that we need, jewelry, all that fun stuff. We will then disinfect the area with surgical scrub. Personally, I like providine iodine, also known as betadine. Once that's done, we will clean it off and then mark the piercing. When marking these piercings, we do it with the person standing and with their arms by their side, feet together. It's important when you're going through this. I know you have an instinct to look down and watch what we're doing. It's best if you look straight ahead because your body and composure changes when you do that. Generally, what we're trying to do is make sure that it's centered and that it's straight up and down. And on most people's bodies, that isn't an exact science. We can't get out a ruler or a leveler or something and figure out what's going to work, what's perfectly level. It doesn't work that way. It's a visual thing. It's also not a bad idea even if they don't offer it, to go take a look at it and see if you like where that placement's going to be. Once we're all set with that, I put you in a reclined position. We take a set of Pennington forceps, flatten out or clamp the tissue. I'll have you do a breathing exercise, breathing through your nose and exhaling through your mouth. Inject the needle in and through, take the forceps off. Using a guide pin, I will insert the jewelry and then put the top on, and then we're done. stop any bleeding that may occur. Usually, sometimes there might be a little bit of slight bleeding immediately afterwards. And then I tell you to go take a look to do the fun part. Afterwards, you might have a little bit of throbbing, aching kind of feeling in the area that'll last anywhere from a couple minutes to a little bit longer. Then it's just going to be a situation where you're not really going to feel any pain unless you bump it just right or move just right. It's not uncommon for people after they get a navel piercing to kind of lead with their stomach, kind of like somebody who's pregnant. They tend to get up like this with their belly out. It's not uncommon for that to happen. Now, the piercing is going to be sensitive to the touch, and it's important that you pay attention to this. Don't just ignore it. If you're doing something and it hurts, it's your body basically yelling at you that, hey, I'm working here. You need to stop doing that because you're making it harder for me to do what I need to do. Most common realizations after this is clothing, of course, sleeping on your stomach, and seat belts and et cetera, or anything that goes around that area. You want to be very cautious with initially. Now, the jewelry will sometimes be a little bit like a millimeter too big just to allow for swelling. These don't really swell a lot. I usually will look at how the body changes, the anatomy, when somebody gets up or sits down and then gets up, just to kind of get an idea if I need to have it a little bit more loose fitting, just to give them a little extra room so that it isn't as uncomfortable. But we don't want so much in there that it's sliding and moving a lot. Let's move on to the healing. Average healing time of these are anywhere from 6 months to a year, during which time I'm going to suggest cleaning twice daily with a sterile saline spray. We suggest Neomed's Piercing Aftercare. It's what we stock here at the studio. We sell can after can of it. But in your part of the world or what have you, that may not be available to you. So what you want to look for is, first off, it needs to be in a pressurized metal can. It should say sterile on it. And when you look on the back of it and you look at the ingredients, you should only see 2 items there. Sodium chloride in purified water. Actually, purified water is always first because there's more of that than the sodium chloride. Anyway, so basically it's water and salt, nothing else. If it has baking soda in it or egg whites or the magical Red Sea, blah, 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 not what you want. Don't get that stuff. Also, it is not the same as nasal sprays and contact solution. There's a lot of people that's misconception that it's all the same. They add things to that for that particular use, including the earwax removal ones. So make sure that it is, in fact, just saline, nothing else. The other thing I suggest is at the end of your shower, stick your belly out, let the water flow over the area for about 30 seconds to a minute. Not only does it feel good if the piercing is a little grumpy, but it also helps to do what we're using the saline for, which is removing that hardened discharge that collects and deposits on the jewelry, the crusties. The reason we want it off there is when the jewelry shifts or moves, which can often happen with this piercing because of where it's located at, if that hard crusty stuff is on there, it can feel like somebody's peeling a scab off, and it can agitate it, which can lead to problems. If you come across a situation where it doesn't seem like that's coming off or you have an obsessive amount of it, see your piercer. Let them clean it for you. Do not run to the medicine cabinet and start pulling out everything you can find that's tipped with cotton or a sharp point or edge or what some stranger suggested on the internet and start digging around in there. The other thing is having a little bit of discharge left over on there is not going to harm the piercing. People get a little overzealous with it. I know it's gross. Plus, let's face it, you just want to pick at it, which you don't want to do. It's going to cause infection, prolonged healing, and other problems if you pick at it all the time. One of the most important parts of this is cross-contamination prevention. It's what keeps it from getting infected. First and foremost, common sense things. Wash your hands before you handle it. No oral contact or exchange of bodily fluids on, near, around the piercing until it's healed. Keep your environment clean. Clothing, bedding, towels, anything that may come in contact with that piercing needs to be cleaned on a regular basis. No swimming. Do not submerge the piercing in bodies of water you can't control the quality of. I know you're going to get mixed opinions on this on the internet. I don't care where you're at in the world. I don't care how well treated any pool is or what have you. Anytime you submerge your whole body in something and move around water that's that large, there's going to be microorganisms in that water. And you have an open wound on your body. With pools, there's the added problem of the chemicals that are in the pools. With natural waters, there's the added problem of any toxic chemicals or pesticides or any type of pollution that may be in that water. Keep the pets away from it. Keep pets away from it. Don't let them sleep in the bed with you, especially under the covers. You also want to limit their access to any clothing that may come in contact with a piercing. I know it's cute and lovely to watch your cat or dog curl up in your clean laundry, but you don't want to know what's transferring from their fur onto your clean clothes. Avoid playing with a piercing. There is no reason to spin it, rotate it, move it, or pick at it. Leave it alone. First 3 to 5 days, you may experience a little bit of slight bleeding off and on. There'll be redness, discolorization, heat, tenderness of the touch. Tenderness of the touch can last much longer, but you need to understand, as I mentioned earlier, that's your body telling you, hey, you need to stop doing that. It's training you to not do that. Once again, do not sleep on the piercing. Make sure you're sleeping on your side or your back. Do not wear clothing that has any contact with that piercing if possible. Low ride, pants are best, sweats, overalls. Also, you can get away with the leggings and etc. The thing is, even if it covers the area, as long as it's elastic and it's not like causing pressure, and if you're wearing it and there's no discomfort, it may not be an issue. Just be very careful. Lastly, if the piercing jewelry is a bit long, and your piercer will probably mention this to you, you want to downsize in roughly anywhere from 6 to 8 weeks to a shorter post. They may wait a little bit longer depending on the situation, but talk to your piercer about that and do downsize. Now let's talk about jewelry. It's going to be pierced initially with preferably a titanium curve with a fixed disc on one side. The top will be either threaded or threadless. That's what you're going to need to wear in that piercing probably indefinitely. You might be able to get away with a ring, like a circular jewelry. You may also get away with just standard barbells with very small balls on the bottom. But those big, large ball on the bottom, smaller ball on the top that everybody loves, that is not probably going to be a possibility for you. Jewelry should be internally threaded or threadless. No externally threaded jewelry at all. And you should have verification that the way to get around this is just go to a reputable studio and a reputable piercer. But if you're buying stuff online, etc., you do need to have that verification that it is certified biocompatible by a third party other than the manufacturer. Should always be 14 gauge or thicker, not smaller gauges. This will, if caught correctly, could rip through you at 16 gauge or 18 gauge. You always want 14 gauge or larger. Large ends with sharp points, angle, things dangling off of it, etc., should probably be avoided during the healing process. Even after that, for day-to-day wear, you might want to wear something kind of simple. Just especially if you notice the larger jewelry gets snagged on things. And then for the fancy weekend, put on the fancy jewelry. Jewelry should be left in at all times, only taking out to replace. Understand, regardless of how long you've had this piercing, if you leave the jewelry out long enough, your body will more than likely reconnect the tissue and close the piercing. If threaded, you should check the security of it. Threadless, it's not a bad idea to occasionally put your index finger in your navel, press it against that disc, and just lightly press down with your thumb on the top to make sure that it's as far down as it can go. It's as secure as possible. Otherwise, yeah, that's pretty much it for jewelry. Now let's talk about living with a piercing. First off, as I mentioned already, I would suggest checking the end if it's threaded at least once a week, just to be on the safe side. Get in that habit, set a day like Tuesday, and Tuesday's ball checking day. And just every Tuesday you check that top and make sure that it's on there. Continue to avoid stress or trauma against the piercing. If it hurts to do something, don't do it. Obsessive trauma to even a healed piercing can lead to migration, rejection, or suddenly the piercing becoming torn and infected, all kinds of things that would cause problems. If you suddenly notice swelling or discomfort in the piercing, even a healed one, consult your piercer as soon as possible. Something's happened and you need to fix it. The piercing will need to be isolated even after it heals. You have hard metal going through soft tissue. Pressure on that piercing can lead to problems. And of course, leave the jewelry in at all times. Let's talk about abandoning the piercing. Let's say you've just gotten to a point where it's just like, I don't want this anymore. If the piercing is healed or it's going through the healing process and there is absolutely no signs of trauma, there's no signs of infection, there's no problems, removing the jewelry shouldn't be an issue. Your body, just take the jewelry out, monitor the area for a few days like you would any cut or puncture wound. If there's any signs of infection or problem, of course, seek medical advice at that point. But for the most part, there's not really much you need to do other than monitor it. Of course, practice cross-contamination prevention to make sure you don't get an infection. If there are signs of problems with the piercing, it is best to consult your piercer or a medical professional before removing the jewelry. We do not want to create a situation where if you have an infection, that once you remove the jewelry, the holes seal up, trapping that infected tissue and fluids inside your body, and you will have to go get medical treatment to get it resolved. Whenever in doubt, see your piercer beforehand just to be on the safe side. Something I talk about in all these videos is sebums because it's a common topic. Sebums is a waxy, oily, oil, kind of has a consistency of cream cheese, very distinct odor, and it will come out of abandoned piercings. It tends to collect around scar tissue sometimes and in crevices. It smells bad, of course, and it's really attributed to larger piercings. Even a piercing, once you've healed it out or removed it or abandoned it, sometimes it'll gather inside the piercing, and then if you squeeze it, it'll come out, and people freak out because they think there's an infection. No, that's completely natural. It's normal. Your body produces that to oil your hair follicles, soften tissue, and also to make you watertight or help make you watertight. Well, that's it. Did I miss anything? If I did, leave a comment. Till next time, here's hoping all piercing seal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I would love to see if your piercing needs in the future. Have a good day, everybody. Take care, and we'll see you in that next video.